Chief Executive Carrie Lam has outlined in her policy address measures to ease the enormous pressure Hong Kong's public healthcare system is facing. Mrs. Lam said following the opening of the first District Health Centre in Kwai Ting last month, the government will speed up the setting up of such centres in all districts. She expected district health centres in 6 more districts and interim centres in the remaining 11 districts will be established within the term of the current government. To boost support for patients with uncommon disorders, the government and the hospital authority plan to implement a series of targeted measures, including examining the setting up of databases for individual uncommon disorders, deploying resources to promote relevant scientific research and development, and enhancing public awareness of uncommon disorders. The government will also strengthen support for drug treatment of patients with uncommon disorders and cancers through the Samaritan Fund and the Community Care Fund. In a bid to improve waiting times for the hospital authority's occupational rehabilitation services, Mrs. Lam proposed to introduce a 3-year pilot program for construction workers. Under the pilot program, a case management approach will be adopted to provide private treatment and rehabilitation services for employees injured at work to facilitate their early recovery. Mrs. Lam suggested to commission the Occupational Safety and Health Council to administer the pilot program through legislative amendments.